Hello, welcome to my channel once again. If you have subscribed, thank you so much and keep coming back. If you are yet to subscribe, please subscribe because here we are talking about everything that is related to the health of your child or your baby. Today we are going to talk about how to stop breastfeeding without pain. We know that right from the time the baby is born till the baby is 6 months of age, the World Health Organization recommends that we do exclusive breastfeeding. That is offering only breast milk to your child, no water, no additional thing unless it is on the instruction of your baby's doctor. But from 6 months, we are supposed to offer appropriate complementary foods to the child. And breastfeeding is supposed to continue until the child is 2 years of age. That means that definitely at a point in time, no matter how you enjoy breastfeeding, no matter how much your baby also enjoys breastfeeding, you will definitely need to stop at a point. And there is a way to manage this process, because if you don't do it well, you will have a lot of guilt feelings, your child will be distressed, you may have breast engorgement, you may have pain, you may even have infection. That is why it's important to manage this process well, and that is what we are talking about today. So, when do you stop breastfeeding? Like I said, the recommendation is exclusive breastfeeding till your baby is 6 months old, and then breastfeeding with complementary feeding until your baby is 2 years old. We know that until the babies are a year old, they are mostly not able to digest the complementary foods we give them very well. So from 6 months, even though they may accept complementary feeding, they are mainly accepting it for taste. They don't get a lot of nutrition. So at that time, they are still getting a lot of nutrition from breast milk. So our advice is that if you need to stop before 2 years old, you must at least delay it until the baby is a year old, because before then, they are really not able to get much from the complementary feeds that they are offered. And you know that we want our children to grow well. We don't want them to be malnourished. When you stop it, it's a decision for just you and your baby to make. The recommendations are there. There are so many people and resources to help you, but that decision should be made only by you and your baby. So how do you stop it? What you need to do is to stop it gradually. Gradually means that you decrease the amount of breastfeeds you offer the child over time, gradually, one step at a time. For instance, you can decrease it by offering one less breastfeed per week. Every week, you reduce the amount of breastfeed you give to your child by one breastfeed. You can start with the one that the child is least interested in. And before you offer this breastfeed, you can give complementary feeding so that the child is not so hungry when you offer the breast. It's almost half full, and then he won't be so enthusiastic when it comes to the breastfeeding. And then you should also try not to empty the breast. Before, when you want to establish lactation, we advise that you empty the breast, because when the breast is empty, then milk comes in. But this time, because you are stopping breastfeeding, it will be a good idea not to empty the breast. Then your body does not produce a lot of breast milk. And because you are reducing the amount of feeds as well, with time, the body gets used to producing less breast milk. In addition, you should offer only one breast at a feed. When you are trying to establish lactation, we ask that you empty both breasts. But when you are stopping, what you should do is to offer only one breast at a feed, and the other breast is still full. And that also helps you to decrease the breast milk production. A lot of older children are only breastfeeding when it's bedtime or when they wake up in the night anyway. And some of them are able to understand. So when you want to stop breastfeeding, you can call your child and explain to them that now you want to offer only big boy food or big girl food, that kind of thing. Sometimes they may understand, sometimes they may not understand. Even those who understand may forget. So you need to keep saying this to them so that they know that it's time for you to stop breastfeeding them. And a lot of them will accept it. The younger ones especially will not accept it. There will be a lot of crying, especially in the night. So how you can manage that if you are not alone is to have another caregiver take care of the child for you in the night when the child wakes up and is crying because of breast milk. Of course, if the child is hungry, the child needs to be fed. And then after that, the other caregiver helps you to put the child back to sleep. And over days, gradually, your body will get used to producing less breast milk because you are breastfeeding less. And then the day you decide to stop, it will not be painful. Sometimes, sudden separation from your baby, for instance, if you are traveling, or there may be another reason why you need to stop breastfeeding abruptly, this will lead to pain. When you have pain, what you need to do is to express just enough of the breast milk so that you are comfortable. Don't empty the breast, because if you empty it, breast milk will come in. And what you need to do, or what you are trying to do, is to send a signal to the body that a lot of breast milk is not needed anymore. So you express just a little until the pain is down and you are comfortable. You throw that away. And you can use over-the-counter pain medications like paracetamol to manage your pain. You wear well-fitted brassieres, and then over time, the pain will diminish because you are producing less and less breast milk. This process that I've explained, stopping breastfeeding, sometimes, as I've just explained, will lead to pain from engorgement, and I've just shown you how to manage it. If you don't manage it well, or sometimes you manage it but still for one or two reasons, the breast can get infected when it's engorged, and then that one, you need to seek medical care for that. When it's infected, the breast is warm, it's very, very painful, it's reddened, then you may even feel feverish. You will need to go to hospital for that, and we hope that it doesn't get there. The other thing is that it can be very distressing when your baby wakes up and wants breast milk and is really, really crying. That is why I said that you can have another caregiver to help you. Then you may have all these guilt feelings. You may be afraid that the attachment that you had, the bond you had with your baby, is going to break just because you have stopped breastfeeding. You can manage that by engaging in other activities with your baby. For instance, you can introduce more play, reading together. There are so many things that you can do together with your baby to help you to bring down that feeling of guilt. But if you are feeling very, very guilty and you are overwhelmed, please try to talk to someone about it, or engage in other activities with your friends and talk to people who have been in similar situations about it as well. I hope this has been helpful to you. We talked about how to stop breastfeeding so that you don't feel a lot of pain. We said that it is best to do it gradually. But if for any reason you need to do it, stop abruptly, what is also called cold turkey, then you can do that by expressing just enough of the breast milk, throwing it away. Don't empty the breast totally, and use pain relief, wear well-fitted braces. And we pray and hope that it goes well for you. Thank you for watching this video. We hope you will return again to watch the next one. Bye-bye.